All right, welcome back from break. I'm not choked up on this one, not that I don't care about our next speaker, but I've recovered from the last. So I want you to help me welcome Matt Leadham. He is a board-certified neurological clinical specialist and assistant professor of physical therapy at the University of South Dakota. For over a decade, his work has focused on Parkinson's disease and other movement disorders, combining clinical care with teaching and research. Clinically, he has worked with individuals with Parkinson's across inpatient, outpatient, and community settings, with a particular interest in improving gait, balance, and overall mobility. His research explores how changes in brain activity contribute to movement difficulties in Parkinson's, with the goal of developing more targeted rehabilitation strategies. He's passionate about translating research into practical, meaningful strategies that people can use in their daily lives. He has shared this work with Parkinson's support groups, community organizations, and healthcare professionals throughout the region, and he is committed to helping people with Parkinson's stay active, safe, and independent. Please help me welcome Matt Leadham to the stage.
All right, thanks everybody for letting me join you here today. I have to tell you, I've been tasked with a difficult challenge of talking about research at the very end of the day, so I will do my very best to keep this entertaining. I'm looking forward to talking to you about research and some of the things that we're doing here locally in South Dakota, but first I couldn't miss an opportunity to share this picture. This is Maryam Ali and I at the World Parkinson's Congress 10 years ago. Yes, right? So it was so fun to be back here today and have things kind of come full circle a decade later. And I have to tell you, she might not remember this encounter with me 10 years ago, but I remember this event this weekend very clearly. So I've been a PT for about 15 years, and during that 15 years, I've worked with hundreds of patients who have had Parkinson's disease. And I think that this conference was the first time when I had really appreciated how big this community was, how big the community of people with Parkinson's around the world is, and the people who are caring for them, and the important roles that all of us have in finding a cure for Parkinson's disease. This conference had about 5,000 participants. There were representatives from more than 65 countries around the world. And my big takeaway from that conference was that each of us has a very important role. You people with Parkinson's disease, you have a very important role. Your caregivers who are standing alongside you have a very important role in finding a cure. Clinicians who are working with the people with Parkinson's, they play an important role, and so do the researchers. And I hope today that when I talk about my role with research, some of my motivations around that, you'll see that all of us need to work together in order to find a cure for Parkinson's and enhance the lives of people living with Parkinson's here in South Dakota. So in order to do that, I wanted to take a step back and look at a little bit of history and recognize some of these research milestones that have occurred since 1817 when James Parkinson wrote his essay on the shaking palsy. So a number of years passed before levodopa came available to people in the community. And since then, for about 60 years, levodopa continues to be the gold standard of treatment for people with Parkinson's disease. And I know that can be quite frustrating. It feels like 60 years have passed and we haven't had any major breakthroughs in research or treatment. But when we look at all of the things that have shown up on this timeline, really there have been lots of new advancements in the treatment and care of people with Parkinson's, and they're increasing in frequency as we get closer to today. Today, where we are, we're looking, or what I research at the University of South Dakota is both brain oscillations, how changes in dopamine in a person's brain affect the signals that are happening in different parts of the brain, and how exercise might influence some of those things, as well as non-invasive brain stimulation. So I'm going to ask you a question, and you don't need to raise your hand or answer out loud, but have you benefited from one of these medications or therapies that have been available? And then I want to ask you, have you ever participated in research? Because I think it's important that we understand that those things are related to each other. That in order to have meaningful changes in the treatments that are available to individuals, we all have to be able to step into a role where we're contributing to the advancement of these new discoveries. And so there's a couple different types of studies that you can participate in. There are observational studies. These are those studies that don't test interventions. They don't include drug treatments or therapies or exercise. They want to take a look at kind of the similar traits amongst people with Parkinson's disease. And then there are interventional trials. There are those studies that include some type of intervention, a drug, a treatment, exercise, where we want to see if there's actually an effect that results in improved performance. Now, clinical trials benefit lots of different people. They benefit researchers, but they also benefit clinicians who are providing care to people with Parkinson's, and they benefit the people with Parkinson's who are living with this condition. One of the challenges with some of these clinical trials is that recruitment can sometimes be difficult, and any delays in recruitment lead to delays in treatment advancement and can delay the time that it takes to get these things into your hands. And the reality is that some treatments may be very promising and some might not help at all. But unless we test those things, we don't know if they can be helpful. I'm going to talk a little bit about clinical trials, and I told you I'm a physical therapist. I'm not a physician, so I'm going to talk about drugs, but this is not the type of research that I do. When we talk about the different phases of clinical trials, really there's three phases before these types of treatments get into your hands. Phase one are studies that are typically done in healthy controls. These are studies that are done in people who don't have Parkinson's disease, and they're to make sure that these interventions are safe for people. Phase two trials usually target people with Parkinson's disease, and they want to make sure that the treatments, the interventions are not only safe, but they're also effective, that they do what we say they do. Phase three trials look at both the effectiveness of treatments and the safety of treatment, but they do it in a broader population of people to make sure that it's generalizable, that the findings are generalizable. And you can see here that each of these trials requires quite a bit of time, and that the number of trials that advance to the next phase gets smaller over time. So if we look at some common medications that are used for people with Parkinson's disease, like Azilect or Requip, some of you are probably very familiar with those medications, you'll see that Azilect took about 15 years before it became accessible to the general public. Requip took 11 years before it became accessible, and some of that is due to delays or limitations in the progression of these drugs through these different stages of clinical trials. And so I want to leave you with this quote, or I want to give you this quote that says, "If I've seen further than others, it's by standing on the shoulders of giants." And this is the way that I think about Parkinson's disease research, especially when it comes to these interventional trials, where you may not be the direct beneficiary of some of these interventions, but the next generation of people with Parkinson's will be. And so you all are the giants that the next generation will be standing on the shoulders of. So we want to do as much as we can in order to provide optimal care and treatments and interventions and opportunities for the next generation of people. So how can you participate in clinical trials? Well, we need lots of different people, not just people with Parkinson's, to participate in research. Yes, we need people with Parkinson's. And different types of clinical trials will ask for different types of people with Parkinson's. Some trials will ask for people with Parkinson's who have freezing of gait. Some will look at just characteristics in groups of men or women or different types of clinical presentation. And then there's studies that depend on people who do not have Parkinson's disease. We want to look at healthy controls. We want to look at care partners or family members or others. I'm especially interested in studying the effects of treatments on care partners. And I think it's interesting you compare two spouses, a person with Parkinson's and a person who doesn't have Parkinson's, and they've been living in the same environment for 20 or 30 years, eating the same food, and yet one person developed Parkinson's disease and the other person didn't develop Parkinson's disease. So here we have an opportunity to explore why that might be. And so studies benefit from incorporating all sorts of people, including care partners and people with Parkinson's disease. And so if you're considering participating in research, you need to ask some specific questions, and you need to really weigh the benefits and the risks. Because while Parkinson's research can be very empowering, it can also expose you to side effects or discomfort or risk. And each of you will have a different threshold of your tolerance to taking on some of those risks. So it's important that you're communicating your thoughts with your family and your care providers and your neurologist. And you talk to the research team about what are the potential benefits of the trial and what are the potential risks of the trial. Part of the process of research is that I have to provide a very extensive list of all the potential risks, including things like exercise. Now, when I put together institutional review board application, I have to describe how, yes, exercise is really good for all people, but it also can elevate heart rate, it can cause stress, and we have to include all of those things in order to get approval, and is something that we should include when we're discussing research participation with participants. So some questions that you might consider asking if you're considering research is, what are the requirements for participating? Are there any direct benefits to me? Are there any risks? Who can see my data, and will the results be shared or stored? There are some studies where we want to collect data over many, many years, and sometimes we use parts of that data for different trials or different studies. And so you want to have a good understanding of how that data will be utilized in the future. So, you might be thinking, okay, this is great. What do I do? How do I participate in research? And what if I'm not comfortable participating in interventional trials? We've got a few different options. You can become a research advocate. The Parkinson's Disease Foundation has an advocate training program that trains people with Parkinson's and their care partners to partner with research scientists to improve how research is designed and conducted. It's a wonderful opportunity. You can go onto the Parkinson's Disease Foundation website and sign up to participate in the training program. If that is not for you, it's also important that we all advocate for improvement in Parkinson's disease care. So you can contact your elected officials, your policymakers, and express your desire to see more action around Parkinson's legislature. A good example of this recently, in 2024, the National Plan to End Parkinson's Act was signed into law. This was the very first time that there was a federal law that was put together that designed a strategic plan to improve the care and treatment for people with Parkinson's disease. And it's through the efforts of advocates like you that this became a reality. Another way that you can participate in research is by donating to organizations that support research. Many organizations, including the Parkinson's Disease Foundation, the Michael J. Fox Foundation, the Davis Phinney Foundation, the American Parkinson's Disease Association, provide grants to fund Parkinson's research. And researchers rely on these grants in order to conduct the studies that they're using. Many of these organizations also provide fellowships, partnerships, and training programs to improve the type of care and the type of training that is received by people who are doing research, to make sure that the researchers that are conducting these trials understand the needs and the unique circumstances of people with Parkinson's disease. You can also participate in local research and national research. There are organizations like the Parkinson's Disease Foundation that has research opportunities that can be done remotely. If you go to their website, you can see a number of different studies that you can sign up for, including the PD genomics study, where you submit your information and they send you a kit. You can swab your cheek and send some information back in, and they're collecting a compendium of data about people with Parkinson's to better educate researchers who are doing this work. The Michael J. Fox Foundation has a Fox Trial Finder where you can identify different projects that you might qualify for or participate in. And clinicaltrials.gov, or the National Institutes of Health, also has a wonderful research finder that you can use to see if there are local research opportunities near you. There's other programs like Research Match, which is a survey-based research website that allows you to be paired with different studies that are looking at things like Parkinson's disease. And that can be really helpful as well, especially for those who are not interested in participating in interventional studies. Now I want to talk just a little bit about some local opportunities and the things that we're doing in our lab at USD. I'm currently enrolling participants for 3 different studies. The basis of all of these studies is non-invasive brain stimulation to improve performance in mobility as well as cognition in people with Parkinson's. So what we know is that dopamine not only causes changes to motor symptoms, but it also causes changes in the ability of groups of cells to communicate effectively. And we can see this on EEG. So if I put a cap on your head with electrodes, we can see changes in the signals in the brain of a person with Parkinson's compared to a person who doesn't have Parkinson's disease. And these changes in signals are related to motor and cognitive impairments that affect the way you move and the way you think. We also know that these abnormal signals, the abnormal communication between these neurons, can be influenced by electrical stimulation. Now, some of you may be familiar with deep brain stimulation, and that is perhaps the most powerful example of how these electrical signals can be influenced by stimulation. Now, deep brain stimulation is an invasive procedure. It is not for everybody, and not everybody qualifies for invasive procedures like deep brain stimulation. So what we're doing in our lab is exploring less invasive versions of electrical stimulation that may also impact the communication of these neurons, these brain cells, throughout the brain. We do that through 2 different types of stimulation: transcranial alternating current stimulation. These are electrodes that just go over the scalp, and then we can use electrical stimulation to apply a current right through the hair and the scalp and into the brain tissue. Another type of stimulation is transcranial magnetic stimulation. It's a little bit more powerful. It uses magnets to change the impulses in the brain. And so we're asking questions like, can we use these non-invasive stimulators to alter the way that these brain cells are communicating with each other? We also are using EEG to help reinforce our understanding of how these brain waves are different in the brains of people with Parkinson's compared to the people who don't have Parkinson's. And we're trying to understand how things like exercise influence the communication of the brain cells. You know, there's no good biomarker for exercise. There's no injection I can give you and we can map the way that that looks in the brain. But we're saying maybe we can use the communication between these brain cells to better understand how exercise improves performance. And the results are really promising so far. And we've seen both in transcranial magnetic stimulation and in transcranial alternating current stimulation that people improve not only in their walking speed, and their gait pattern, but that we can also see underlying changes in their brain tissue and the way that those neurons are communicating with each other. I've got a little video here. This is a video of an individual prior to receiving transcranial magnetic current stimulation. And here's a video of him after 1 session of this brain stimulation. So you saw in that first video, there's some difficulty with initiating movement. There was some freezing of gait. And after 1 session of transcranial magnetic stimulation, non-invasive brain stimulation, we saw a dramatic improvement in performance of movements. So this gives all of us hope. And it gives us an opportunity to join together in order to fight for a cure and to improve the lives of people with Parkinson's disease. So can you help with these studies? We're looking for individuals with Parkinson's disease, and we're looking for healthy controls, your care partners, family members, friends, who can help us to better understand not only the underlying brain signals and some of those communication networks within the brain, but also how these interventions can improve performance. Unfortunately, because we're using electrical stimulation, if you've had a cardiac pacemaker or you've had deep brain stimulation, we can't enroll you in participation in this study. But this is a great reminder that, again, like when I was at the World Parkinson's Congress, that we all need to work together in order to come up with a plan and a solution and to inspire each other and to give each other hope for the future. So if this is something that you're interested in, I do have a QR code here. You can fill out a survey online. You don't have to, signing up here doesn't require you to participate in research. It gives you an opportunity to request more information where we can contact you. We also have paper signups in the back, and we'd be happy to visit with you at the resource table to discuss more about what these projects look like, what the risks are, what the potential benefits could be, and to help you help all of us and help each other in order to find a cure for Parkinson's. Are there any questions for me? Yeah. Sorry, microphone here.
Oh, sorry. I have two questions. One, starting with the intracranial electric stimulation, is that different than an ECT?
Then a
Same concept?
cardiogram?
The electric shock therapy that they use to change, manage and treat mental illnesses?
So when we're using the transcranial alternating current stimulation, I should talk a little bit about this too. The exciting part of this is that the technology is not very sophisticated. You can run these stimulators on a 9-volt battery. And the idea here is that if this device shows promise, if this is something that you could put on with a baseball cap and then do your exercises, and that improves your performance by 10%, that might make a meaningful difference in the lives of somebody with Parkinson's disease. And this is a device that in the future, we're doing this in-home study where I'm sending a stimulator home with you to put on while you do exercises. That might be something that could be eventually commercially available and accessible to help improve access and technology for people who live, especially in rural parts of the world where they might not have access to in-clinic settings or access to technology that you might experience in your neurologist's office.
So like an ECT, it's a recurring treatment
Yes.
type of a...
Yes.
And then my second question is, with the sleep studies that they do, you know, when all of the testing with a new diagnosis, the sleep study EEGs, are they using that kind of the information that they're gathering with them then for your benefit as well?
So we do EEG just like in the sleep studies, but the focus of our EEG really is in the parts of the brain that control movement. So while they're looking at other parts of the brain that affect sleep and wakefulness, our EEGs really are focused on just those parts of the brain that control movement and are affected in Parkinson's disease.
Oops, sorry.
So do you have to go to Vermilion, to USC, to meet up with you, or can you do things remotely?
So we have 3 projects going on right now. One project is in Vermilion, the Transcranial Magnetic Stimulation Project. Rezwan Palabak here, he's a PhD student, and he's the primary contact for that project. That one's done in Vermilion. We have a lab in Sioux Falls at Sanford, where we're doing a series of laboratory tests there on transcranial alternating current stimulation. And then we have a third project that requires a couple of visits to the Sioux Falls lab, but then we send that stimulator home with you where you're using the stimulation and doing exercise on your own in your own environment.
Matt, filling out one of the forms from the
Yes.
website, it gives you 4 choices, but you can't check them all.
Okay.
If you, levels of interest with exercise or brain stimulation or surveys, what if it's all of the above?
Click one of them and I'll call you. How about that, Barry?
Say, I picked up a sheet back here that's talking about motor control and cognition.
Yes.
If you have deep brain stimulation, are you still interested in somebody like that or not?
I'm very interested in that, but unfortunately we can't use the electrical stimulation as an intervention for somebody who's already had deep brain stimulation.
Yeah.
However, there may be opportunities in the future for other studies where we're maybe not looking at just brain stimulation, but looking at exercise or other types of intervention that could also improve cognition or motor function in people who do have deep brain stimulation.
2 years ago, I had DPS installed, and there were supposed to be 2 guys from USD there doing a study. I never did hear anything back from them. Is there anything to that, or I was just curious?
I'm not sure if that was a project that we've been working on 2 years ago for deep brain stimulation implants. No.
These were 2 guys from USD.
So I'm part of Dr. Arun Singh's lab at USD. He does a lot of research on Parkinson's disease and involves other collaborators from other programs as well. So that may have been a project that he was overseeing, but not one that I'm familiar with.
Okay.
A few years ago, I had something like deep brain magnetic stimulation in my psychiatrist's office. Is that the same thing?
I think that was similar to this question up here. I'm not sure exactly what they do with that type of stimulation with the psychiatrist or psychologist.
They put magnets on my head.
It very well may have been transcranial magnetic stimulation, which is what we're doing with one of our projects, but I'm not entirely sure.
Would that disqualify her from?
No.
No.
Yeah, no.
So you could still participate?
I've already donated my body to research at USD. Does that affect donating to this program too, or?
No. So if we would love to have any participants who meet the eligibility requirement participate in these projects or in these studies. If there are any other things, past history of medical conditions or other things that you'd like to discuss with us, we'd be happy to visit with you in the back about some of that too.
We had a group member at our Parkinson's support group that came in with a device called a beach band. I'm wondering if you've heard about that or what the research is or isn't saying about those.
I'm very vaguely familiar with the beach band. I think it uses vibration, right, to help influence motor performance as well. It's a relatively new product, but I think like some of these other things, it does seem to be showing some potential benefit for some individuals. The question was, do you recommend genetic testing for everyone? I think this is like any participation in research or intervention. This is something that you have to discuss with your care partners, your family members, because while information can be really helpful, it also carries some weight, right? And so there's a difference between seeking genetic testing and working with a genetic counselor and doing other things like 23andMe and finding out that you maybe carry the Parkinson's gene and not getting any additional follow-up care. Sure. Yeah, there's Parkinson's is a very complex disorder, as you all know, right? It's complex in its etiology. It's complex in the way that symptoms present within an individual, and is complex in the way that symptoms present between individuals. And so this is exactly why it's difficult to come up with new treatment interventions that are a solution for all individuals. And so there are lots of things like these projects here that that the goal is to provide some meaningful treatment that may help groups of people with Parkinson's, even if they can't help all people with Parkinson's disease as well. Thank you so much for your time here today. I really appreciate the opportunity.